Hi everyone, I'm Dr. Logan here at Elevate with another Doc Talk. Today we're going to talk about inflammation post-surgery. What is it, why it's important to manage, and what we can do about it. First, surgery itself causes tissue injury, which is a disruption of the tissue and triggers a response of the body, a three-stage response of recovery. You have first the acute inflammation phase, which could last up to 6 days after surgery. This is when your body is sending repair cells to initiate healing. So this is where you can get some swelling, redness, pain, as an increased movement of fluids carrying white blood cells, growth factors, and enzymes go into the area to start healing. Second, you have your subacute or proliferation phase. That's going to be about 4 days to about a month after surgery. So this is where signs of inflammation end and you're going to get new tissue formation. Edges of the wound are going to come together. You're going to have some fragile tissue that needs to be protected because it's susceptible to injury. You could now also get a return of sensation, so maybe some sharp shooting pains or some itchiness to the area can be shown here. Then you finally have your chronic phase or remodeling phase. This can go anywhere between several months to a couple years after your procedure. This is when the new tissue organizes itself and matures, wounds will fill in, and your scars will go from red and raised to flattening out and normalizing more towards your natural skin tone. But let's talk about the inflammation phase, because this is what we're going to deal with right after surgery. So the severity depends on the amount of trauma or the severity of your procedure that's done, and can be very much influenced by the amount of vascularization or oxygenation of the tissue. So one thing to keep in mind is that inflammation is different than swelling. People think that they're the same, but inflammation is specifically the first phase of a three-phase part of healing, while swelling is specifically the accumulation of increased fluid and inflammatory processes to the injured area. So there is a difference. Inflammation is a defensive mechanism to help with repair and recovery. So inflammation itself starts with blood clotting to prevent more blood loss. Then after that, there's actually an increase in permeability, so the blood vessels open up, allowing for more fluid to the injured interstitial space. That's also going to include your white blood cells, macrophages. These are going to start with tissue developing and repair, and it's also going to help clear debris and produce those essential hormones that we're going to need for tissue regeneration. The way that this fluid is circulated is through the lymphatic system, and that is actually our drainage system of the body. That allows us to continue with circulation of the areas. It's a one-way transport for excess fluids. This relies very heavily on contraction of our muscles. We call that a muscle pump. So if you don't have muscles contracting, you're not going to get a propulsion of fluid throughout the lymphatic system, and you can cause a lot of stagnation there. Some would say that if there's too much inflammation, not enough evacuation, this is going to allow for the inability for the waste products and excess swelling to subside and allow for that next stage of repair and recovery. That's why more recently it's been shown that resting in ice specifically have actually been shown to delay recovery. So the whole RICE method has actually been VITIVS proven. Movement and compression are the main ones, and we'll go into that a little bit, but mild movement is going to help the tissue heal faster. Application of cold is going to suppress the immune system and not allow good vasodilation and circulation of fluid. So again, post-surgery, you're going to expect some pain, a little bit of swelling, a little bit of redness that should gradually go away. There's going to be some drainage, right? Keep the wound clean, and then some itching as your sensory system returns. Make sure that you're watching out for infections. So if you're feeling a fever, if there's unexplained sweating, if there's any pus or ooze coming out of the wound that has a foul odor, any increased redness or pain that's getting worse, you may need to contact your provider for further instructions. So how do we treat this? Post-operative management is really focused on increasing comfort and helping enhance recovery. So we want to make sure that you're in good physical health even before you go into surgery. That way you're going to have better circulation, which will allow for better healing. You're going to have some swelling, but again, swelling management, if you do this, you're going to prevent potentially pulmonary edema, pneumonia, or even blood clots to form that could get lodged in your legs or even worse, your heart or your brain. So early mobility is very important and is going to help with reducing the swelling. And that's something that your healthcare team is going to provide you with appropriate exercises based on your procedure at the time. You don't want to be doing too much that could damage the procedure or prevent the healing to form. You're going to make sure that you're mobilizing your lymphatic fluid, reducing swelling. Again, the more that you manage the swelling, the better you're going to improve the overall healing process. So that can include wearing compression stockings. This can help preventing blood clots, and then also elevating your limb above the heart based on, again, what your procedure is. Ice, it is going to be helpful for pain, right? We do get given analgesics, pain medication as well. Those are there as needed, but again, we want to try to avoid long-term use of that to prevent any type of any considerations or other issues with the organs. Mobility. So it's been shown through countless studies that early interventions, early therapy, and movement has shown a positive impact on the range of outcomes, including pain, quality of life, physical function, and depression from not being able to do what you want to do. So staying active as much as possible appropriately is going to help reducing swelling and boost your chances of a smooth recovery. Again, your therapist or provider will give you the appropriate exercises, but we want to help strengthen those muscles as soon as we can, return the range of motion, and increase blood flow around whatever our surgical site is to help with healing. This is also going to help with draining away fluid and getting rid of any of that excessive swelling or tenderness. Dressings. This is something, again, you're going to be following the instructions of your surgeon, but make sure you ask them what the dressing situation is. Do you need to change it? Do you need to leave it as is? Change things if the dressing gets wet or dirty, but also obviously protecting the wound from further infection or disruption of the healing is most important. And then nutrition. Nutrition is key. Make sure that you're providing the body with the right nutrients to recover. So make sure you're getting good vitamins, multivitamins, and supplements to help reduce the swelling. Vitamins A and C are very important. Any anti-inflammatory diets that would be rich in whole grains, a lot of plants, a lot of fruits and vegetables, plant-based fats, olive oils, avocado oils, and proteins, herbs and spices that are low in sodium. All of those things can help combat post-surgery inflammation. That'll also help with just comfort in general and decrease tenderness. You want to stay hydrated and eat well. I can't stress that enough. You want to stay healthy to give your body the right nutrients it needs to recover optimally. If you have any further questions, contact us here at Elevate, and we'll help you with your recovery. Thanks again. Have a good day.